Why did you choose nursing?
I chose nursing for several compelling reasons. Firstly, the dedication and compassion demonstrated by my family members who are nurses deeply influenced my decision. Witnessing their unwavering commitment to patient care and the positive impact they made on individuals' lives inspired me to pursue this noble profession. Secondly, nursing resonates with my core values and aspirations. Above all, I am driven by a genuine desire to help others and contribute to their well-being. Providing comfort, support, and medical care during moments of vulnerability is deeply fulfilling to me. I believe that nursing offers a unique opportunity to make a meaningful difference in people's lives every day, aligning perfectly with my personal ethos. Moreover, nursing offers a wealth of career opportunities and avenues for professional growth. Whether it's advancing to roles like nurse practitioner or specializing in areas such as pediatrics or oncology, the potential for development and specialization is vast. Additionally, the global demand for skilled nurses presents exciting prospects for international work. The opportunity to experience different cultures while providing essential healthcare services to those in need is both enriching and rewarding. In essence, nursing encompasses my passion for helping others, aligns with my values, and offers a fulfilling career path with endless possibilities for growth and impact.
Can you tell us a little about your experience in nursing?
I have been a registered nurse for over 8 years, during which I have gained diverse clinical and patient care experience. I started my nursing career in a general medical surgical ward, where I managed patients with a variety of acute and chronic conditions, honing my skills in assessment, medication administration, and post-operative care. After 3 years, I transitioned to working in the emergency department of a tertiary care hospital, which exposed me to high-pressure situations requiring quick decision-making, teamwork, and adaptability. In my most recent role, I specialized in critical care nursing in the intensive care unit, providing care for patients with complex medical needs, including those on ventilators and life support systems. This position deepened my understanding of advanced nursing practices and technology-driven care. Alongside my clinical duties, I also served as a mentor to new nurses, helping them transition into practice by sharing my knowledge and guiding them through challenging scenarios. Throughout my career, I have prioritized patient-centered care, ensuring that every decision I make considers the physical, emotional, and psychological needs of my patients and their families. These experiences have shaped my holistic approach to nursing and my ability to work effectively in multicultural and interdisciplinary teams. I am passionate about lifelong learning, and I've attended several workshops and completed certifications in areas such as advanced cardiac life support and infection prevention. This comprehensive experience has equipped me with the skills and adaptability to provide exceptional care in diverse healthcare settings.
Why are you the best person for this nursing job?
I believe I am the best person for this nursing job because of my combination of clinical expertise, compassionate care, and strong communication skills. First, my clinical training and hands-on experience have equipped me with the knowledge and skills necessary to provide high-quality patient care. I have completed rigorous academic coursework and clinical rotations in various settings, including hospitals, clinics, and long-term care facilities, which have given me a well-rounded understanding of patient needs and the ability to adapt to different environments. Second, I am deeply committed to patient-centered care. I prioritize empathy and compassion in all my interactions, understanding that each patient is unique and deserves personalized attention. My ability to connect with patients on a personal level helps build trust and ensures that they feel supported and understood throughout their healthcare journey. Additionally, I have strong communication and teamwork skills. I am adept at collaborating with multidisciplinary teams to develop and implement effective care plans. My ability to communicate clearly and effectively with patients, families, and colleagues ensures that everyone is informed and involved in the care process. Moreover, I am highly organized and detail-oriented, which is crucial in a fast-paced healthcare environment. I can manage multiple tasks efficiently while maintaining a high standard of care. My dedication to continuous learning and professional development also means that I stay updated with the latest advancements in nursing practice, ensuring that I provide the best possible care to my patients. Overall, my clinical skills, compassionate approach, effective communication, and dedication to excellence make me the ideal candidate for this nursing position. I am confident that I can contribute positively to your team and provide outstanding care to your patients.
How do you handle workplace stress? Or, how do you deal with the stress of nursing?
Handling workplace stress is a critical aspect of being an effective nurse, and I have developed several strategies to manage it effectively. One of the key approaches I use is maintaining a strong sense of organization and prioritization. By keeping a detailed schedule and to-do list, I ensure that I am on top of my responsibilities and can tackle tasks systematically, reducing the feeling of being overwhelmed. Additionally, I practice mindfulness and stress relief techniques such as deep breathing exercises and brief meditation sessions during breaks. These practices help me stay centered and calm, even during the most hectic shifts. Another important aspect of managing stress is seeking support from colleagues. Nursing is inherently a team-based profession, and I believe in the power of collaboration and mutual support. By discussing challenging situations with my peers and supervisors, I can gain new perspectives and advice, which not only helps in finding solutions but also fosters a sense of camaraderie and shared purpose. Furthermore, I am proactive about seeking feedback and continuously improving my skills, which boosts my confidence and reduces anxiety about handling complex cases. Outside of work, I prioritize self-care by engaging in activities that recharge me mentally and physically. Regular exercise, a balanced diet, and adequate sleep are essential components of my routine. I also make time for hobbies and activities that I enjoy, such as reading, spending time with family and friends, and exploring nature. These activities provide a much-needed break from the demands of the job and help me return to work with a refreshed and positive mindset. By combining these strategies, I can effectively manage workplace stress and maintain a high level of performance and well-being. This holistic approach ensures that I am able to provide the best care for my patients while also taking care of my own health and happiness.
What do you do if your replacement doesn't arrive on time?
During a busy evening shift at the hospital, my replacement for the night shift had not arrived on time. This was concerning because it was a peak time with several patients needing continuous care. My primary responsibility was to ensure that patient care remained uninterrupted while also addressing the issue of the absent replacement. It was crucial to maintain a smooth transition between shifts to ensure the safety and well-being of our patients. First, I informed the charge nurse about the situation to ensure that the management was aware of the delay. Then, I checked the staff schedule to see if any other nurse could step in temporarily or if any adjustments could be made. While waiting for a solution, I continued to monitor my patients closely, updating their charts and administering any necessary medications to ensure their care was not compromised. I also made sure to communicate with my patients, letting them know that I was still there to assist them and address any of their immediate needs. By taking these steps, we were able to manage the situation without any disruption to patient care. The charge nurse found another nurse who could temporarily cover until my replacement arrived, which minimized the impact of the delay. My patients received consistent care, and the transition to the night shift was eventually completed smoothly. This experience reinforced the importance of teamwork, communication, and flexibility in ensuring high-quality patient care, even in unexpected situations.
Do you work well with other nurses, doctors, and staff members?
Absolutely, I work very well with other nurses, doctors, and staff members. Collaboration and teamwork are essential components of providing high-quality patient care, and I prioritize building strong, professional relationships with my colleagues. I believe effective communication is key to teamwork. I make it a point to clearly and respectfully communicate with my fellow nurses, doctors, and other staff members, ensuring that everyone is on the same page regarding patient care plans and any changes that need to be made. I also actively listen to their input and value their perspectives, as healthcare is a multidisciplinary field where each team member's expertise contributes to the overall well-being of the patient. Furthermore, I am always willing to lend a helping hand and support my colleagues when needed. Whether it's assisting with a difficult procedure, covering for someone during a busy shift, or sharing knowledge and skills, I am committed to fostering a cooperative and supportive work environment. In addition, I regularly participate in team meetings and interdisciplinary rounds, which help in coordinating care and addressing any issues that may arise. By working collaboratively, we can provide more comprehensive and effective care to our patients. Overall, my ability to work well with others, combined with my commitment to effective communication and teamwork, ensures that we can deliver the best possible care to our patients.
Describe how you manage a busy workload.
Managing a busy workload effectively is essential in nursing, and I use several strategies to stay organized and ensure high-quality patient care. First, I prioritize tasks based on urgency and importance. At the beginning of my shift, I review the patient's charts and care plans, identifying which tasks need immediate attention and which can be scheduled for later. This helps me create a clear plan for the day and ensures that critical tasks are addressed promptly. Second, I maintain meticulous documentation. Keeping accurate and up-to-date records helps me track patient progress, medications, and treatments, reducing the risk of errors and ensuring continuity of care. This also allows for more efficient handovers to the next shift, as they can quickly understand the patient's current status and needs. Effective time management is another crucial aspect of handling a busy workload. I break down larger tasks into smaller, manageable steps and set realistic time frames for completing each one. This approach helps me stay focused and reduces the likelihood of feeling overwhelmed. Additionally, I make sure to delegate tasks appropriately. Understanding the strengths and competencies of my colleagues allows me to assign tasks to the right people, ensuring that patient care remains efficient and effective. I also utilize technology to streamline my workflow. Electronic health records, EHRs, and other digital tools help me access patient information quickly, communicate with other healthcare team members, and manage my schedule more efficiently. Moreover, I remain adaptable and flexible. In a dynamic healthcare environment, unexpected situations often arise. I stay calm and composed, quickly adjusting my plans as needed while maintaining a high standard of care. Lastly, I prioritize self-care and stress management. Taking short breaks when possible, practicing mindfulness, and seeking support from colleagues help me stay resilient and focused throughout my shift. By combining these strategies, prioritization, meticulous documentation, effective time management, appropriate delegation, technology utilization, adaptability, and self-care, I can manage a busy workload efficiently while providing excellent patient care.
How do you respond when people ask for your personal diagnosis outside of a clinical setting?
When approached for personal diagnosis outside of a clinical setting, I approach the situation with empathy and professionalism. I kindly explain that offering medical advice or diagnosis without a proper examination is neither ethical nor safe. I stress the importance of consulting a qualified healthcare provider who can conduct a thorough assessment and provide tailored recommendations based on their specific health needs. I express understanding for their concerns and reassure them that seeking professional medical help is the best course of action. I might suggest making an appointment with their primary care physician or visiting a nearby healthcare facility for further evaluation. Additionally, I offer to provide general health advice or direct them to reliable resources where they can find information about their symptoms or conditions. Maintaining professional boundaries and upholding ethical standards is crucial in such situations to ensure the individual's well-being and safety. By guiding them towards appropriate medical care, I strive to support their health journey responsibly and compassionately.
What's your strongest skill as a nurse?
My strongest skill as a nurse lies in effective communication. I firmly believe that clear and empathetic communication is the cornerstone of providing exceptional care. Whether I'm interacting with patients and their families, or collaborating with fellow healthcare professionals, I prioritize listening attentively and conveying information in a manner that is easily understandable and compassionate. In my experience, I've found that strong communication not only fosters trust and rapport with patients but also allows me to better understand their needs and concerns. By actively listening and engaging with patients, I can address their fears, clarify any doubts, and involve them in decision-making regarding their care, empowering them to take an active role in their health journey. Furthermore, effective communication extends beyond patient interactions to encompass collaboration within interdisciplinary teams. By communicating clearly and succinctly with colleagues, I ensure that everyone is on the same page regarding patient care plans, facilitating seamless coordination and promoting optimal outcomes. Ultimately, my commitment to communication as a nurse enables me to establish meaningful connections with patients, provide personalized care, and contribute to a supportive and cohesive healthcare environment.
What's the hardest thing about being a nurse?
As a nurse, one of the most challenging aspects of our profession is grappling with the emotional toll that comes with caring for patients, especially during times of suffering and loss. Witnessing patients in pain, dealing with difficult diagnoses, or experiencing tragic outcomes can take a significant emotional toll on us. We invest deeply in our patients' well-being, and when we are unable to alleviate their suffering or prevent negative outcomes, it can be incredibly challenging to cope with feelings of helplessness and grief. Additionally, the demanding nature of nursing, both physically and emotionally, can lead to burnout and fatigue. Long hours, high-stress environments, and the constant need to stay alert and attentive to patients' needs can wear us down over time. Balancing the demands of the job with self-care and maintaining a healthy work-life balance is an ongoing struggle for many nurses. Furthermore, navigating complex healthcare systems, dealing with administrative tasks, and encountering obstacles that impede the delivery of quality care can be frustrating and disheartening. As advocates for our patients, we strive to provide the best possible care under challenging circumstances, but bureaucratic hurdles and resource constraints can hinder our efforts. Despite these challenges, nurses remain resilient and dedicated to our profession. We find strength in the relationships we build with our patients and colleagues, and we draw upon our passion for helping others to persevere through difficult times.
How would you handle a patient who struggles with pain management?
Recently, I encountered a patient who was struggling with pain management following a surgical procedure. Despite receiving medication, they continued to experience significant discomfort, which was impacting their recovery and overall well-being. My task was to assess the patient's pain management needs comprehensively and develop an effective plan to alleviate their discomfort while promoting their recovery. Firstly, I approached the patient with empathy, acknowledging their pain and validating their experience. I engaged in active listening to understand the nature and intensity of their pain, as well as any concerns or preferences they had regarding pain management. I assessed their vital signs and conducted a thorough physical examination to identify any underlying factors contributing to their pain. Next, I collaborated with the interdisciplinary team, including physicians, pharmacists, and other healthcare professionals, to review the patient's medical history, surgical procedure, and current medication regimen. Together, we discussed potential interventions and adjustments to optimize pain relief while minimizing side effects and risks. Based on the assessment findings and collaborative discussions, I developed a tailored pain management plan for the patient. This plan included a combination of pharmacological interventions, such as adjusting the dosage or type of pain medication, implementing non-pharmacological interventions like relaxation techniques or guided imagery, and ensuring adequate hydration and nutrition to support healing. I educated the patient and their family about the importance of adhering to the pain management plan, including the proper administration of medications, potential side effects to watch for, and when to seek assistance if the pain persists or worsens. I emphasized the importance of open communication and encouraged the patient to express any concerns or changes in their pain experience promptly. Through a collaborative and patient-centered approach, we were able to effectively address the patient's pain management needs. The patient reported a significant improvement in pain relief and overall comfort, which positively impacted their recovery and quality of life. By empowering the patient to take an active role in managing their pain and providing comprehensive support, we achieved optimal outcomes and fostered a sense of trust and partnership in their care journey.
How would you handle a crisis such as an outbreak?
In the midst of the COVID-19 pandemic, our healthcare facility faced the daunting challenge of managing an outbreak within our community. The rapid spread of the virus posed a significant threat to the health and safety of both patients and healthcare workers, requiring a coordinated and decisive response. My task was to collaborate with the healthcare team to implement effective measures to contain the outbreak, mitigate its impact, and ensure the safety and well-being of patients and staff. Firstly, I ensured clear and timely communication with all members of the healthcare team, keeping them informed about the evolving situation, updated guidelines, and protocols for infection control and prevention. I facilitated regular meetings to discuss strategies, address concerns, and coordinate our response efforts. Next, I worked closely with infection control experts and public health authorities to conduct thorough contact tracing, identify individuals potentially exposed to the virus, and implement quarantine or isolation measures as necessary. We established designated areas within the facility for the care of COVID-19 patients, ensuring proper isolation protocols and adequate staffing to provide comprehensive care while minimizing the risk of transmission. I also played a key role in educating patients, families, and staff about infection prevention practices, including proper hand hygiene, mask wearing, and social distancing measures. We implemented screening protocols for all individuals entering the facility, including temperature checks and symptom assessments, to identify potential cases early and prevent further spread. Additionally, I supported the emotional well-being of patients and staff by providing empathetic support, addressing concerns, and connecting them with resources for coping with stress and anxiety related to the outbreak. We implemented measures to ensure the availability of personal protective equipment, PPE, and prioritized the mental health needs of frontline healthcare workers, offering support services and counseling as needed. Through a coordinated and proactive response, we successfully managed the outbreak, containing the spread of the virus within our healthcare facility and safeguarding the health and safety of patients and staff. Our efforts to implement comprehensive infection control measures, educate and support individuals, and prioritize communication and collaboration were instrumental in mitigating the impact of the crisis and navigating through this challenging period.
What inspired you to become a nurse?
From a young age, I was drawn to helping others and had a deep sense of empathy for people in difficult situations. One pivotal moment that truly inspired me to become a nurse was when a close family member was hospitalized for a serious condition. I saw firsthand how the nursing staff not only provided expert medical care but also offered emotional support and compassion to my family during such a challenging time. It was their kindness, patience, and dedication that left a lasting impression on me and planted the seed for my own journey into nursing. As I grew older, my interest in health sciences and my desire to make a tangible difference in people's lives led me to pursue nursing as a career. What attracted me most was the unique combination of science and humanity that nursing offers, being able to understand complex medical concepts while connecting with patients on a personal level. I saw nursing as a profession that would allow me to be an advocate for those in need, a source of comfort during uncertainty, and a provider of care that truly makes an impact. This inspiration has stayed with me throughout my career, fueling my commitment to excellence in patient care and my ongoing passion for learning and growing in the field of nursing.
How do you handle stress on the job?
Handling stress effectively is crucial in nursing, given the nature of the job and the responsibility of caring for patients in often high-pressure situations. Over the years, I've developed strategies that help me stay focused, resilient, and maintain a sense of balance. Firstly, I prioritize staying organized and setting clear goals for my shifts. By planning my tasks and anticipating potential challenges, I can manage my workload more efficiently and reduce the feeling of being overwhelmed. I also focus on staying present in the moment and tackling one task at a time, which helps me maintain clarity even in hectic environments. I've learned to rely on teamwork and open communication as essential tools for managing stress. Sharing the workload with colleagues, asking for support when needed, and discussing concerns with my team creates a supportive work environment. Additionally, I practice self-awareness, recognizing the signs of stress early and taking proactive steps to address them, whether that's pausing for a deep breath, prioritizing tasks, or seeking guidance from my supervisor when necessary. Outside of work, I make it a priority to practice self-care. Regular exercise, mindfulness meditation, and maintaining a healthy work-life balance are some ways I recharge and maintain my emotional well-being. Engaging in activities I enjoy, such as reading or spending time with family, also provides an essential outlet for stress. Ultimately, I view stress as a natural part of nursing and an opportunity to grow stronger in my role. My ability to remain calm under pressure and adapt to rapidly changing circumstances ensures that I can continue to provide the highest standard of care for my patients while safeguarding my own well-being.
Can you describe a time when you had to deal with a difficult patient? How did you manage the situation?
During my time working in the emergency department, I encountered a patient who was in severe pain and understandably very frustrated. The patient was verbally aggressive, demanding immediate attention, and dismissive of any attempts to explain the necessary procedures. It was a challenging situation because the emergency department was particularly busy that day, and prioritizing care based on clinical urgency was critical. I knew the key to managing the situation was to remain calm, empathetic, and professional. I started by acknowledging the patient's frustration and validating their feelings with a calm and understanding tone, saying, "I can see that you're in a lot of pain, and I want to help make this better for you as quickly as possible." This approach helped to de-escalate their anger and showed them that I was genuinely invested in their well-being. Next, I explained the situation in clear and simple terms, letting them know that we were prioritizing care to ensure everyone's safety and that I was doing everything possible to expedite their treatment. To further ease their concerns, I stayed by their side, checking on them frequently and updating them on the progress of their care. This not only reassured them but also demonstrated that their concerns were being taken seriously. Eventually, the patient became more cooperative, and I was able to provide the necessary care without further conflict. This experience reinforced the importance of active listening, empathy, and clear communication in building trust and diffusing tense situations. It also reminded me how critical it is to remain composed and patient, even in the face of challenges, to ensure the best outcomes for everyone involved.
What do you find most rewarding about being a nurse?
What I find most rewarding about being a nurse is the opportunity to make a meaningful difference in people's lives during their most vulnerable moments. Knowing that my care, whether through a kind word, a skilled procedure, or simply being present to listen, can provide comfort and hope to patients and their families is deeply fulfilling. Nursing allows me to connect with people on a personal level and witness their resilience, which is both humbling and inspiring. One of the most rewarding aspects is seeing patients recover and regain their strength after challenging health battles. Being part of that journey, from providing initial critical care to watching them improve and eventually leave the hospital, is incredibly gratifying. It's a constant reminder of the impact of teamwork, compassion, and expertise in healthcare. I also find great satisfaction in the relationships I build, not just with patients, but with their families as well. Guiding them through difficult times and helping them navigate complex medical decisions is a privilege I don't take lightly. Additionally, mentoring new nurses and contributing to their growth in the profession brings me immense joy, knowing that I'm helping to shape the future of nursing care. Above all, nursing gives me a sense of purpose. It's a profession where every day is an opportunity to learn, grow, and touch lives in ways that are truly significant. That ability to positively impact someone's health and well-being is what I cherish most about being a nurse.
How do you prioritize tasks while managing multiple patients?
Prioritizing tasks while managing multiple patients is a critical aspect of nursing, and I rely on a combination of clinical judgment, organizational skills, and effective communication to ensure each patient receives the care they need. I start by assessing and reassessing the acuity of my patients' conditions. Patients with life-threatening or rapidly deteriorating situations always take precedence. For example, if a patient requires immediate intervention to stabilize their vital signs, they will be my top priority. Once critical needs are addressed, I categorize tasks based on urgency and complexity. I use tools like the ABC, airway, breathing, circulation, framework or consider factors such as pain management, time-sensitive medications, and scheduled treatments. Clear documentation and a structured plan help me stay on track and avoid overlooking any tasks. Effective communication with my team is another key strategy. I delegate tasks to other team members, such as healthcare assistants or fellow nurses, when appropriate. By collaborating and ensuring that everyone is aligned on patient priorities, I can manage my workload more efficiently and maintain high standards of care. Time management is also crucial. I try to group similar tasks, such as administering medications to multiple patients at once, while ensuring I don't rush through interactions that require patient education or emotional support. I also make it a point to anticipate potential challenges, such as a procedure taking longer than expected, and adjust my priorities dynamically as situations change. Ultimately, staying flexible, organized, and patient-focused ensures that I can effectively juggle the demands of multiple patients while delivering safe and compassionate care.
How do you stay current with medical practices and advancements in nursing?
Staying current with medical practices and advancements in nursing is essential to providing high-quality patient care, and I take a proactive approach to professional development. I regularly attend workshops, seminars, and conferences focused on the latest research, techniques, and technologies in nursing. These events not only expand my knowledge but also allow me to engage with experts and peers in the field, fostering a collaborative learning environment. I am also committed to pursuing continuing education. For instance, I have completed certifications such as Advanced Cardiac Life Support, ACLS, and updates in infection control practices, which align with my areas of focus in critical care nursing. These programs deepen my expertise and keep me informed about the latest standards and guidelines. In addition to formal training, I stay informed by subscribing to reputable medical journals and nursing publications, such as the American Journal of Nursing or Nursing Times. These resources provide valuable insights into emerging trends, evidence-based practices, and case studies that I can apply to my work. Online platforms, including webinars and e-learning courses, have also become a convenient and effective way to stay updated. Collaboration with colleagues is another important aspect of staying current. I actively participate in departmental meetings and discussions, where we review new protocols, share best practices, and reflect on recent experiences. Learning from the diverse perspectives of my peers enriches my understanding and helps me integrate new knowledge into my daily practice. Above all, I embrace a mindset of lifelong learning. By staying curious and seeking opportunities to grow, I ensure that I remain at the forefront of advancements in nursing, ultimately benefiting the patients and families I care for.
Describe a time when you caught a potential mistake in a patient's care. How did you handle it?
During one of my shifts in the intensive care unit, I was preparing to administer medication to a patient with a complex medical history. As part of my routine, I double-checked the medication order against the patient's chart and noticed a discrepancy in the dosage. The prescribed dose seemed unusually high for this particular drug, especially given the patient's age and renal function. Recognizing the potential for harm, I immediately paused and reviewed the patient's lab results and medical history again to confirm my concerns. I then contacted the prescribing physician to clarify the order. After discussing the case, the physician acknowledged that there had been an error in the dosage calculation and thanked me for catching it before the medication was administered. The order was corrected, and the appropriate dose was given without any harm to the patient. After resolving the issue, I documented the incident and followed the hospital's protocol for reporting potential medication errors. I also shared the experience with my team during a debrief to emphasize the importance of vigilance and thoroughness in medication administration. This situation reinforced the critical role nurses play as a safeguard in patient care. By adhering to the 5 rights of medication administration, right patient, right drug, right dose, right route, and right time, and maintaining open communication with the healthcare team, I was able to prevent a serious error and ensure the safety of my patient.
How do you handle conflicts with colleagues or other healthcare professionals?
Handling conflicts with colleagues or other healthcare professionals requires a combination of professionalism, empathy, and effective communication. I approach conflicts with the mindset that we all share the same ultimate goal: providing the best possible care for our patients. With this in mind, I strive to resolve differences constructively and maintain a positive working relationship. One example occurred when a colleague and I disagreed about the prioritization of tasks during a particularly busy shift. Rather than allowing the situation to escalate, I took a moment to pause and address the issue directly but respectfully. I asked if we could discuss our perspectives and understand each other's reasoning. By listening actively and expressing my viewpoint calmly, I was able to clarify my concerns while also recognizing their valid points. To find common ground, we focused on the patient's needs and worked collaboratively to adjust our plan. This not only resolved the immediate conflict but also strengthened our teamwork for future situations. I made sure to follow up with my colleague later, thanking them for their input and emphasizing how much I valued their expertise. In general, I believe that open communication is the key to resolving conflicts effectively. I make it a point to address issues promptly rather than letting them fester and ensure that my approach is centered on solutions rather than blame. If a situation requires further assistance, I am not hesitant to involve a supervisor or mediator to facilitate resolution in a fair and unbiased manner. Ultimately, maintaining mutual respect, fostering a culture of teamwork, and focusing on shared goals help me handle conflicts professionally while ensuring that patient care remains the top priority.
What nursing certifications do you currently hold?
I currently hold several certifications that reflect my commitment to professional growth and maintaining high standards of patient care. These include Registered Nurse License. I am fully licensed to practice as a registered nurse in your country/region, having met all the required standards of education and examination. Advanced Cardiac Life Support, ACLS. This certification has equipped me with advanced skills in managing cardiovascular emergencies, including cardiac arrest and arrhythmias, which is essential in critical care and emergency settings. Basic life support, BLS. This foundational certification ensures that I am prepared to respond effectively to life-threatening situations, such as performing CPR and using an AED, in both clinical and community settings. Pediatric Advanced Life Support, PALS. This certification enables me to provide specialized care for pediatric patients experiencing emergencies, ensuring I can support patients across all age groups. Infection Control Certification. Through this certification, I have gained a deep understanding of protocols to prevent and manage infections in healthcare settings, safeguarding both patients and staff. Additionally, I actively pursue continuing education to expand my skill set and stay current with advancements in nursing. These certifications, combined with my clinical experience, allow me to deliver comprehensive and evidence-based care to my patients.
How would you deal with a family member who is unhappy with a patient's care?
Dealing with a family member who is unhappy with a patient's care requires empathy, active listening, and a calm, solution-oriented approach. I understand that family members are often deeply concerned about their loved ones and may feel stressed, frustrated, or helpless in such situations. My primary focus is to validate their concerns, address the issue at hand, and restore their confidence in the care being provided. In one instance, a family member expressed frustration that their loved one's pain management seemed inadequate. I began by listening attentively, allowing them to fully explain their concerns without interruption. I acknowledged their feelings, saying, "I can understand how difficult this must be for you, and I appreciate you bringing this to my attention." After understanding their specific concerns, I reassured them that I would look into the matter promptly. I reviewed the patient's pain management plan and consulted with the physician to discuss potential adjustments. Once a plan was in place, I updated the family member and explained the steps we were taking to address the issue. I also encouraged them to ask any questions and made sure they felt heard and included in the process. Throughout the interaction, I remained calm, respectful, and empathetic, even if emotions ran high. By focusing on finding a solution and keeping the lines of communication open, I was able to address their concerns effectively and rebuild trust. Ultimately, I believe that transparency, empathy, and timely action are key to resolving such situations. By involving family members in the care process and showing them that their concerns are taken seriously, I aim to foster a collaborative and supportive environment.
Can you explain how you ensure patient confidentiality and privacy?
Ensuring patient confidentiality and privacy is a fundamental part of my role as a nurse and is critical to maintaining trust and providing ethical care. I adhere strictly to the principles of confidentiality outlined in regulations such as HIPAA, or the equivalent in my region, and my workplace's policies to protect patient information. I take several practical steps to safeguard patient confidentiality. For instance, I only access or share patient information on a need-to-know basis, ensuring that it is relevant to the care being provided. When discussing patient information, I do so discreetly and only with authorized individuals, such as members of the healthcare team directly involved in the patient's care. Conversations about sensitive matters are conducted in private areas to avoid being overheard. In handling electronic records, I ensure that I log out of systems after use and avoid accessing records on shared or unsecured devices. I am vigilant about protecting physical documents as well, ensuring that they are stored securely and not left unattended. When interacting with patients, I also prioritize their privacy during care delivery. For example, I ensure curtains are drawn, doors are closed, and consent is obtained before performing procedures or discussing their health status. I am mindful of their dignity, allowing them to feel safe and respected throughout their treatment. Additionally, I stay updated on evolving regulations and best practices through ongoing training and education. By combining vigilance, professionalism, and respect for patients' rights, I ensure that confidentiality and privacy are upheld at all times, fostering trust and creating a secure care environment.
Describe your experience with electronic health records.
My experience with electronic health records, EHRs, spans several years and has been integral to my daily nursing practice. I am proficient in using various EHR systems, including insert-specific systems, e.g., Epic, Cerner, or Meditech, and I have utilized them extensively for documenting patient care, retrieving medical histories, and coordinating treatment plans. In my current role, I use EHRs to chart patient assessments, record vital signs, update medication administration records, and document care plans in real time. This ensures that the information is accurate, comprehensive, and accessible to all members of the healthcare team. I also leverage EHR tools to flag potential issues, such as drug interactions or overdue labs, contributing to safer and more effective care. One area where EHRs have been particularly beneficial is in patient handoffs. By using standardized templates within the system, I ensure that my notes are clear and detailed, allowing for seamless communication between shifts. Additionally, I am adept at generating and interpreting reports from EHRs to track patient outcomes, monitor trends, and support quality improvement initiatives. I have also trained new staff members on best practices for EHR use, emphasizing the importance of accuracy, timeliness, and confidentiality. My ability to navigate these systems efficiently not only enhances my workflow but also ensures that patient care remains at the forefront. Overall, my experience with EHRs has equipped me with the technical skills and attention to detail necessary to maximize their utility in improving patient care and streamlining healthcare processes.
How do you approach educating patients about their health and treatments?
Educating patients about their health and treatments is a fundamental part of nursing care, and I approach it with a focus on clarity, empathy, and patient-centered communication. My goal is to empower patients to take an active role in their care by providing them with the knowledge and resources they need to make informed decisions. I begin by assessing the patient's baseline understanding of their condition and treatments. This helps me tailor the information to their level of knowledge and address any misconceptions they may have. I also consider their preferred learning style. Some patients respond well to verbal explanations, while others benefit from visual aids like diagrams or written instructions. When providing education, I use simple, non-technical language to ensure the information is clear and avoid overwhelming the patient. For example, if explaining a new medication, I'll discuss what it is for, how to take it, potential side effects to watch for, and why it's important to follow the prescribed regimen. I encourage questions throughout the conversation and check for understanding by asking the patient to repeat the key points in their own words. I also take cultural and language barriers into account, using interpreters or culturally relevant materials when needed to ensure that education is accessible and meaningful. If a family member is involved in the patient's care, I include them in the discussion with the patient's consent, fostering a supportive environment. Follow-up is another crucial part of my approach. I provide written materials or resources for the patient to review later and encourage them to reach out if they have further questions. If appropriate, I schedule follow-up discussions to reinforce the education and address any new concerns. By making patient education a collaborative and ongoing process, I help patients feel informed, confident, and equipped to manage their health effectively.
What measures do you take to prevent the spread of infection?
Preventing the spread of infection is a cornerstone of nursing practice, and I strictly adhere to evidence-based infection control protocols to protect patients, colleagues, and myself. I take a comprehensive and proactive approach to minimizing infection risks, starting with consistent hand hygiene. I follow the World Health Organization's 5 moments for hand hygiene, ensuring I wash or sanitize my hands before and after patient contact, after exposure to bodily fluids, and after touching patient surroundings. I also adhere to the appropriate use of personal protective equipment, PPE, such as gloves, gowns, masks, and eye protection, based on the level of exposure risk. Proper donning and doffing techniques are critical to preventing cross-contamination, and I am vigilant about following these steps meticulously. In patient care, I maintain strict aseptic techniques during procedures such as catheter insertion or wound dressing to minimize the risk of introducing infections. I also ensure that medical equipment is properly sterilized and disposed of according to hospital protocols, and I educate patients and families about their role in infection prevention, such as handwashing and the importance of adhering to treatment plans. Environmental cleanliness is another focus area. I collaborate with housekeeping staff to ensure that patient rooms and high-touch surfaces are regularly disinfected. Additionally, I stay updated on hospital infection control policies and attend regular training to keep my knowledge of best practices current. Finally, I am vigilant about monitoring for signs of infection in patients, such as fever or unusual wound discharge, and act promptly to address potential issues. By combining strict adherence to protocols with ongoing education and teamwork, I effectively contribute to preventing the spread of infection and maintaining a safe care environment.
How do you provide emotional support to patients and their families?
Providing emotional support to patients and their families is an integral part of nursing, and I approach it with empathy, active listening, and a patient-centered mindset. I understand that hospitalization and medical treatments can be stressful and overwhelming, so I strive to create a compassionate and supportive environment. The first step is to build trust by being present and approachable. I make an effort to introduce myself clearly, explain my role, and ensure patients and their families feel comfortable asking questions or expressing their concerns. By listening actively and without judgment, I can better understand their emotional needs and offer tailored support. For example, if a patient is feeling anxious about a procedure, I provide clear and reassuring explanations about what to expect, using simple language to reduce uncertainty. I also share coping strategies, such as deep breathing techniques, to help them manage their stress. If a family member is struggling with the emotional toll of their loved one's condition, I take the time to acknowledge their feelings and validate their experiences, reassuring them that their concerns are heard and respected. Sometimes, emotional support means simply being present. Sitting with a patient during a difficult moment or offering a kind word can make a significant difference. For families, I encourage open communication and involve them in the care process as much as the patient permits. Providing them with updates and actionable steps they can take helps them feel included and empowered. If needed, I connect patients and families with additional resources, such as social workers, chaplains, or counseling services, to address deeper emotional or spiritual needs. By taking a holistic approach and treating each individual with care and respect, I aim to ease their emotional burden and foster a sense of hope and resilience.
Can you share an example of how you've contributed to a team effort in your nursing role?
Collaboration is at the heart of nursing, and I believe that teamwork is essential to delivering safe and effective patient care. One example of my contribution to a team effort occurred when I was working in the emergency department during a mass casualty incident. The situation required the entire team to coordinate seamlessly under intense pressure to triage and treat multiple patients simultaneously. As part of the team, I took the lead in setting up a triage area, ensuring that supplies and equipment were readily available. I quickly assessed incoming patients, prioritizing them based on the severity of their conditions and communicating vital information to the attending physicians and other nurses. I also collaborated with colleagues to stabilize critical patients, taking on tasks such as starting 4 lines, administering medications, and monitoring vital signs. Throughout the event, I made a conscious effort to maintain clear communication with my team, providing updates and alerting others to changes in patient conditions. When a junior nurse expressed uncertainty about a procedure, I stepped in to guide and support them, ensuring that patient care was not delayed. At the same time, I relied on my team members' expertise and input, knowing that effective collaboration was key to managing the crisis efficiently. After the situation was under control, I participated in a debriefing session where we discussed what went well and identified areas for improvement. Contributing to this reflective process reinforced the importance of teamwork and helped us prepare for future challenges. This experience underscored how essential it is to trust and support one another in high-stakes environments. By working together, we were able to provide timely, quality care to all patients, even under extraordinary circumstances.
What is your experience with administering medication and monitoring side effects?
My experience with administering medication spans a wide range of clinical settings, including medical surgical wards, emergency departments, and intensive care units. I am well versed in the principles of safe medication administration, including verifying the 5 rights: the right patient, right medication, right dose, right route, and right time, before administering any drug. I have administered various forms of medication, including oral, intravenous, subcutaneous, and intramuscular, as well as managed infusions for patients on continuous drips like insulin, analgesics, and vasopressors. In each case, I ensure that I review the physician's order, cross-check it with the patient's medical history, and account for any allergies or contraindications before proceeding. Monitoring for side effects is an essential part of the process, and I remain vigilant for any adverse reactions during and after administration. For example, I carefully observe patients for signs of anaphylaxis when administering new medications or closely monitor vital signs for changes when starting high-risk infusions. I also educate patients about potential side effects to watch for and encourage them to communicate any discomfort or unusual symptoms promptly. In one instance, a patient receiving an antibiotic infusion began showing early signs of an allergic reaction, including itching and mild swelling. Recognizing these symptoms, I immediately stopped the infusion, administered antihistamines as per the protocol, and informed the physician. I documented the event thoroughly and updated the patient's chart to prevent future exposure to the allergen. My experience has taught me the importance of precision, observation, and communication in medication administration. By adhering to protocols, educating patients, and staying alert to side effects, I ensure safe and effective medication management.
How do you handle a situation where a patient refuses treatment?
When a patient refuses treatment, I approach the situation with empathy, respect, and a focus on understanding their perspective. I recognize that patients have the right to make decisions about their care, and my goal is to support them while ensuring they are fully informed about the implications of their choices. First, I engage the patient in a calm and non-judgmental conversation to understand the reasons behind their refusal. This may involve exploring their concerns, fears, cultural beliefs, or personal preferences. For example, if a patient refuses a specific medication due to fear of side effects, I provide clear and concise information about the benefits of the treatment, potential risks, and alternatives. I use language that is easy to understand and avoid medical jargon, ensuring that they feel heard and valued. If the patient remains hesitant, I encourage open dialogue and involve other members of the healthcare team as needed. This might include bringing in the attending physician, a social worker, or a family member, with the patient's consent, to provide additional support and address any remaining concerns. In one instance, a patient with diabetes refused insulin therapy due to a fear of needles. I took the time to demonstrate how to use an insulin pen, discussed ways to minimize discomfort, and offered emotional reassurance. By involving a diabetes educator and providing alternative management options, we were able to create a care plan that the patient was comfortable with, fostering their cooperation. If the patient continues to refuse treatment after all options have been explored and explained, I respect their decision and document the interaction thoroughly, noting the patient's reasons and the information provided. I also ensure that the patient knows they can revisit their decision and seek care at any time. Ultimately, my approach is guided by respect for the patient's autonomy while striving to provide the best possible care and support within their comfort and preferences.
What are your strengths as a nurse, and how do they benefit your work?
My strengths as a nurse lie in my ability to combine clinical expertise, compassion, and effective communication to provide exceptional patient care. These qualities have consistently allowed me to excel in my role and contribute positively to my healthcare team. One of my key strengths is my adaptability. Nursing often involves working in fast-paced and unpredictable environments, and I thrive under these conditions. Whether it's responding to an emergency, managing multiple patients with varying needs, or quickly learning new protocols, I stay calm and focused, ensuring that I prioritize tasks effectively and deliver safe, efficient care. Another strength is my strong interpersonal skills. I build trust and rapport with patients and their families by listening actively, showing empathy, and addressing their concerns with patience and respect. This ability to connect on a personal level helps create a supportive and positive experience for those under my care, even during challenging situations. My clinical expertise and attention to detail are also significant strengths. I am thorough in my assessments, diligent in administering treatments, and proactive in identifying potential issues, such as early signs of infection or medication side effects. These skills contribute to positive patient outcomes and prevent complications. Lastly, I value teamwork and collaboration. I work well within interdisciplinary teams, ensuring open communication and mutual support to achieve the best results for our patients. Whether mentoring a new nurse, contributing to a team effort during a busy shift, or advocating for a patient's needs during care planning meetings, I take pride in fostering a cohesive and effective working environment. These strengths not only enhance the quality of care I provide but also contribute to a harmonious and efficient healthcare setting, benefiting both patients and colleagues.
Have you ever been involved in a medical emergency? How did you react?
Yes, I have been involved in several medical emergencies throughout my nursing career, and each experience has reinforced the importance of staying calm, focused, and decisive under pressure. One situation that stands out occurred during my time in the intensive care unit when a patient experienced cardiac arrest. As soon as the patient's condition deteriorated, I quickly activated the hospital's emergency response system and initiated basic life support measures. I ensured that the patient's airway was clear, started chest compressions, and called for the crash cart. While performing CPR, I provided clear and concise updates to the responding team, including the patient's vital signs, medical history, and the events leading up to the arrest. When the code team arrived, I transitioned seamlessly into a supportive role, assisting with tasks such as preparing medications, attaching the defibrillator, and documenting the timeline of interventions. Throughout the event, I maintained clear communication with my colleagues, ensuring that everyone was coordinated and focused on the patient's recovery. The teamwork and swift actions of the entire team resulted in the successful resuscitation of the patient. After the emergency, I participated in the debriefing session, reflecting on what went well and identifying areas for improvement in future responses. This experience highlighted the importance of being prepared, knowledgeable, and composed during emergencies. By relying on my training in advanced cardiac life support, ACLS, following established protocols, and collaborating effectively with my team, I was able to contribute to saving a patient's life. It also reaffirmed my commitment to staying up to date with emergency procedures and continuing to develop my skills to be ready for any situation.
What steps do you take to ensure you're providing culturally competent care?
Providing culturally competent care is essential to ensuring that every patient feels respected, understood, and supported, regardless of their background. To achieve this, I take a proactive and empathetic approach to understanding and accommodating diverse cultural beliefs, values, and practices in my nursing care. The first step I take is to educate myself about cultural diversity. I participate in cultural competency training and stay informed about the customs, traditions, and healthcare practices of the populations I serve. This ongoing learning helps me approach each patient interaction with sensitivity and awareness. When caring for a patient, I prioritize open and respectful communication. I ask questions to understand their preferences and needs, such as dietary restrictions, religious practices, or traditional remedies, and incorporate these into their care plan whenever possible. For example, I've worked with patients who preferred gender-specific care providers due to cultural norms, and I ensured their requests were honored. I also strive to overcome language barriers by utilizing professional interpreters or translation tools when necessary. This ensures that patients fully understand their diagnosis, treatment options, and care instructions while giving them the opportunity to express their concerns or preferences without miscommunication. Empathy and active listening are at the heart of my approach. I take the time to understand each patient as an individual, recognizing that cultural identity is only one aspect of their overall experience. By fostering trust and showing genuine interest in their perspective, I create an environment where patients feel safe and valued. Finally, I work collaboratively with interdisciplinary teams, including social workers and community health advocates, to provide holistic and culturally sensitive care. By respecting and accommodating cultural differences, I not only improve the patient's healthcare experience but also enhance their outcomes by ensuring they are fully engaged in their treatment plan.
How do you manage your time effectively during a shift?
Managing time effectively during a shift is essential for providing high-quality care and maintaining a safe and efficient workflow. I rely on organization, prioritization, and adaptability to ensure that I meet the needs of my patients and the demands of the unit. At the start of each shift, I review my assignment and assess the acuity of my patients to determine immediate priorities. I then create a mental or written plan, outlining tasks such as medication administration, treatments, and patient education. While I follow this plan, I also leave room for flexibility, knowing that unexpected situations often arise in nursing. Prioritization is key to time management, and I use clinical judgment to focus on tasks that are urgent or time-sensitive. For example, stabilizing a patient with critical needs takes precedence over non-urgent documentation, which I can complete later. I also group similar tasks, such as checking vital signs or administering medications for multiple patients in one round, to save time without compromising care. Effective communication and delegation play an important role as well. I work closely with colleagues to coordinate patient care and delegate tasks appropriately, such as asking a healthcare assistant to assist with routine vital signs while I focus on a more complex procedure. Clear communication ensures that the entire team is aligned and working efficiently. I also make it a point to stay organized throughout the shift. By keeping my workspace tidy, updating patient records promptly, and double-checking my schedule, I reduce the risk of errors and last-minute stress. If an unexpected emergency arises, I adjust my plan and reprioritize tasks to accommodate the new situation without losing track of ongoing responsibilities. Lastly, I take short moments for self-care, such as staying hydrated and taking brief breaks when possible, to maintain focus and energy throughout the shift. By balancing careful planning with adaptability, I ensure that my time is used effectively to deliver safe, patient-centered care.
Can you discuss your experience with palliative and end-of-life care?
My experience with palliative and end-of-life care has been both professionally rewarding and personally meaningful, as it allows me to provide comfort and dignity to patients and their families during some of the most challenging times of their lives. I have worked with patients facing terminal illnesses in both acute care settings and hospice environments, focusing on pain management, symptom relief, and emotional support. One of my key responsibilities in palliative care has been assessing and managing patients' physical symptoms, such as pain, nausea, or shortness of breath, using a combination of medications and non-pharmacological interventions. I am skilled at titrating medications like opioids and antiemetics to maximize comfort while minimizing side effects, all while closely monitoring patients' responses and making adjustments as needed. Equally important is addressing the emotional, psychological, and spiritual needs of patients and their families. I make an effort to create a calming presence, listen actively to their concerns, and provide empathetic support. For instance, I have facilitated conversations about patients' goals of care, helping them and their families navigate decisions regarding treatment options or advanced directives. By fostering open communication, I aim to ensure that the care provided aligns with their values and wishes. I also collaborate with interdisciplinary teams, including social workers, chaplains, and palliative care specialists, to provide holistic and comprehensive support. For example, I've worked with chaplains to address patients' spiritual concerns and partnered with social workers to connect families with bereavement resources or financial assistance. One memorable experience involved caring for a patient with advanced cancer who wanted to spend their final days at home. I coordinated with the palliative care team to arrange for home hospice services, educated the family on symptom management, and ensured a smooth transition. Seeing the family find peace in honoring their loved one's wishes was deeply fulfilling. These experiences have reinforced my belief in the importance of compassion, active listening, and personalized care in palliative and end-of-life nursing. It is a privilege to be part of this journey, ensuring that patients receive comfort and dignity while supporting their loved ones.
What strategies do you use to maintain a positive patient experience?
Maintaining a positive patient experience is one of my top priorities as a nurse, and I use a combination of empathy, communication, and personalized care to create a supportive and comforting environment for patients and their families. One key strategy is building trust and rapport from the beginning. I introduce myself warmly, explain my role, and make an effort to learn the patient's name and preferences. Simple acts, like addressing them respectfully and asking about their comfort, help establish a connection and make patients feel valued. Clear and compassionate communication is another essential component. I take the time to explain procedures, treatments, and care plans in a way that is easy to understand, using non-technical language. I encourage questions and provide reassurance, ensuring that patients feel informed and confident in their care. For instance, when a patient expressed anxiety about an upcoming surgery, I walked them through each step of the preparation process, addressing their concerns and offering reassurance to help ease their fears. I also focus on individualized care. Every patient is unique, so I tailor my approach to meet their specific needs, whether it's adjusting their position for comfort, advocating for their preferences, or accommodating cultural or religious considerations. For example, I've supported patients by providing meal options that align with their dietary restrictions or religious practices, ensuring they feel respected and cared for. Another strategy one uses is being attentive to the small details that make a big difference in the patient's experience. This includes responding promptly to call lights, ensuring their room is clean and comfortable, and providing emotional support during stressful moments. For families, I keep them informed and involved in the patient's care, helping them feel like active partners in the process. Finally, I regularly reflect on patient feedback and take steps to improve their experience further. Whether through formal surveys or informal conversations, I value their input and use it to enhance the quality of care I provide. By combining compassion, communication, and attentiveness, I strive to create a positive and supportive atmosphere that helps patients feel respected, heard, and cared for during their time in the healthcare system.
How do you keep yourself motivated in challenging situations?
Staying motivated in challenging situations is essential in nursing, as the demands of the job often require resilience, adaptability, and a strong sense of purpose. I find motivation by focusing on my passion for helping others, maintaining a positive mindset, and drawing strength from both personal and professional strategies. First and foremost, I remind myself of the impact I have on my patients' lives. Knowing that my care, no matter how small it may seem, can bring comfort, hope, or healing inspires me to give my best even in difficult circumstances. Reflecting on past experiences where my efforts made a difference helps me stay grounded and motivated. I also focus on the aspects of my work that bring me fulfillment. Whether it's forming meaningful connections with patients, collaborating with my team, or learning something new each day, I try to find joy in the process, even during challenging times. Celebrating small successes, such as helping a patient reach a milestone or receiving a simple "thank you," gives me a sense of accomplishment and keeps me moving forward. Maintaining a positive mindset is another key factor. I practice self-care by taking brief moments during my shift to reset, whether it's a deep breath, a sip of water, or a quick moment of mindfulness. Outside of work, I prioritize activities that recharge me, such as spending time with loved ones, exercising, or pursuing hobbies, to maintain a healthy work-life balance. Support from my colleagues is also a significant source of motivation. I find that sharing challenges and successes with my team fosters a sense of camaraderie and reminds me that I'm not alone in facing difficult situations. Together, we lift each other up and keep our focus on our shared mission of providing the best care possible. Finally, I view challenges as opportunities for growth. Each difficult situation teaches me something valuable, whether it's a new skill, a deeper understanding of my patients, or an appreciation for the strength of teamwork. This mindset helps me stay motivated and approach challenges with resilience and determination.
What is your process for reporting and documenting patient care?
Reporting and documenting patient care is a critical responsibility in nursing, as it ensures continuity, safety, and accuracy in patient management. I follow a structured and thorough process to ensure that all information is recorded and communicated effectively. For documentation, I adhere to the principles of accuracy, timeliness, and confidentiality. I use electronic health records, EHRs, or the designated documentation system at my workplace to record assessments, interventions, patient responses, and any changes in condition. I make sure to document immediately after providing care or observing a significant event to minimize errors caused by delays. I use clear, objective language and include relevant details, such as vital signs, medications administered, and any patient-reported symptoms. When reporting, I prioritize effective communication. During shift handovers, I use standardized tools such as SBR, situation, background, assessment, recommendation, to provide concise and structured updates to incoming staff. This ensures that critical information is not overlooked, and the next nurse has a clear understanding of the patient's status and ongoing care needs. If an incident or unusual event occurs, such as a patient fall or an adverse reaction to medication, I follow the organization's protocols for incident reporting. I complete the required forms accurately, describing the event in factual terms without assigning blame, and submit them promptly to the appropriate department. I also inform my supervisor and collaborate with the healthcare team to address the situation and prevent future occurrences. Throughout my documentation and reporting, I ensure compliance with legal and ethical standards, including maintaining patient confidentiality. I regularly review and stay updated on institutional policies and best practices to ensure that my documentation supports quality care and legal accountability. By adhering to a meticulous and consistent process, I ensure that my documentation and reporting contribute to clear communication, patient safety, and effective care coordination across the healthcare team.
How do you handle receiving constructive criticism?
I view constructive criticism as an invaluable opportunity to grow and improve as a nurse. Handling feedback with an open mind and a positive attitude is essential for personal and professional development, and I've worked to cultivate these qualities throughout my career. When I receive constructive criticism, my first step is to listen actively and avoid becoming defensive. I focus on understanding the feedback fully by asking clarifying questions if needed, ensuring that I grasp the specific areas for improvement and the rationale behind the suggestions. For example, if a colleague points out a more efficient way to manage a task, I take the time to reflect on how I can integrate that into my practice. I approach criticism with a mindset of gratitude, recognizing that the feedback is meant to help me succeed and provide better care for my patients. Instead of viewing it as a judgment, I see it as guidance that helps me enhance my skills and address any blind spots I may have. After receiving feedback, I take proactive steps to apply it. I reflect on my actions, identify areas where I can adjust my approach, and create a plan to implement the suggested changes. For example, if I'm advised to improve my time management, I might prioritize tasks more effectively or use a checklist system during my shift. I also seek out additional resources, such as training or mentorship, if I feel further development is needed. Lastly, I follow up to ensure that I'm meeting expectations. I may ask my supervisor or colleague for input on whether they've noticed improvements and if there's anything else I can work on. This demonstrates my commitment to learning and growth. By embracing constructive criticism with humility and action, I continuously improve my practice and strengthen my contributions to the team and my patients.
What do you think are the biggest challenges facing the nursing profession today?
The nursing profession faces several significant challenges today, many of which stem from the evolving demands of healthcare and societal changes. These challenges require resilience, adaptability, and systemic solutions to ensure that nurses can continue to provide high-quality care. One of the most pressing challenges is staffing shortages. Many healthcare facilities are experiencing a shortage of nurses, which increases workloads and leads to burnout among existing staff. This not only impacts the well-being of nurses but can also affect patient safety and the overall quality of care. Addressing this issue involves not only recruiting more nurses but also creating supportive work environments that prioritize retention and well-being. Another major challenge is burnout and mental health concerns. The emotional and physical demands of nursing, compounded by factors such as long shifts, understaffing, and the impact of crises like the COVID-19 pandemic, have taken a toll on many nurses. Supporting mental health through counseling services, adequate time off, and fostering a culture of self-care is crucial to addressing this issue. Adapting to technological advancements is another challenge. While new technologies such as electronic health records, telehealth, and advanced medical devices improve efficiency and outcomes, they also require ongoing education and adjustment. Nurses must stay current with these advancements while maintaining the human connection that is central to patient care. Additionally, addressing health disparities and providing culturally competent care is increasingly important. As the patient population grows more diverse, nurses must be equipped to navigate cultural, linguistic, and socioeconomic differences to deliver equitable care. This requires ongoing education and institutional support to address systemic barriers and biases. Lastly, the profession continues to grapple with advocacy and recognition challenges. Nurses are at the forefront of patient care, yet they often face obstacles in having their voices heard in policymaking and decision-making processes. Strengthening the role of nurses as advocates for both their patients and their profession is essential to creating a healthcare system that fully values their contributions. Despite these challenges, I believe the nursing profession has the resilience and determination to overcome them. By investing in education, mental health resources, leadership opportunities, and systemic change, the profession can continue to thrive and adapt to the demands of modern healthcare.
How do you ensure you're adhering to all healthcare laws and regulations?
Adhering to healthcare laws and regulations is a fundamental responsibility in nursing, and I take a proactive and systematic approach to ensure compliance in every aspect of my practice. This commitment not only protects patients but also upholds the integrity of the profession and my workplace. Firstly, I stay informed about the latest healthcare laws, regulations, and policies at the local, state, and national levels. I achieve this by attending mandatory training sessions, participating in continuing education courses, and reviewing updates from trusted sources like professional nursing organizations or my employer. For example, I regularly refresh my knowledge of laws related to patient confidentiality, such as HIPAA, to ensure I handle sensitive information appropriately. In my day-to-day practice, I follow established protocols and guidelines meticulously. Whether it's adhering to infection control procedures, verifying medication orders, or documenting care accurately and timely, I ensure my actions align with legal and institutional standards. For instance, I always double-check patient identifiers before administering treatments to comply with safety regulations. Communication and collaboration are also essential to ensuring compliance. I actively participate in team discussions, such as shift handovers and care planning meetings, to stay aligned with the best practices and institutional policies. If I encounter a situation where legal or ethical concerns arise, I don't hesitate to seek guidance from supervisors, compliance officers, or legal advisors to clarify the appropriate course of action. Moreover, I am vigilant about reporting any observed breaches of laws or regulations. Whether it involves a safety concern, medication error, or ethical issue, I document and escalate the matter through the proper channels, ensuring that corrective actions are taken to protect patients and uphold standards. Finally, I reflect on my practice regularly and seek feedback from colleagues and mentors to identify areas for improvement in adhering to regulations. By maintaining a focus on education, vigilance, and accountability, I ensure that I meet my legal and ethical obligations while delivering the highest standard of care.
Can you describe a time when you had to advocate for a patient?
Sure, I'd be happy to share. During my clinical rotation in the medical surgical unit, I cared for a patient who had just undergone major abdominal surgery. He was experiencing significant pain, but his prescribed pain management regimen didn't seem to be effective. I noticed he was hesitant to speak up about how much pain he was in, perhaps because he didn't want to bother anyone. After assessing his pain levels and realizing that his discomfort was affecting his ability to participate in post-op activities like deep breathing and early mobilization, I decided to advocate on his behalf. I spoke with the attending physician and explained how his current pain management plan wasn't meeting his needs. I provided specific examples of how his pain was hindering his recovery and suggested adjustments to his medication regimen. The physician agreed to modify the plan, and once the new protocol was implemented, the patient's pain became much more manageable. He was able to participate in physical therapy and meet his recovery milestones. Afterward, the patient expressed how grateful he was that someone had taken the time to listen and act on his concerns. That experience reinforced for me the importance of being a patient advocate and ensuring that their voices are heard, especially when they're in a vulnerable state.
How do you assess a patient's needs and develop a care plan?
Assessing a patient's needs and developing a care plan is a collaborative and systematic process that combines clinical knowledge with a patient-centered approach. I typically start with a comprehensive assessment, which includes gathering subjective data through active listening and open-ended questions. For example, I'll ask the patient about their symptoms, medical history, lifestyle, and any concerns they have. I also pay attention to nonverbal cues, like body language or facial expressions, which can sometimes tell me more than words. Next, I perform an objective assessment by conducting physical examinations and reviewing vital signs, lab results, and any diagnostic tests. This gives me a clearer picture of their clinical status. For instance, if a patient presents with shortness of breath, I'll assess their oxygen saturation levels, lung sounds, and any contributing factors like fluid overload or anxiety. Once I have all the information, I collaborate with the patient and, if appropriate, their family to establish goals. These goals are always specific, measurable, and realistic. For example, if a patient is recovering from surgery, a goal might be to ambulate 50 feet within 3 days to prevent complications like blood clots or pneumonia. Using this information, I develop a care plan that outlines the interventions needed to meet those goals. The care plan isn't static, it's dynamic. I evaluate the patient's response to the interventions regularly and adjust the plan as needed. For example, if pain management strategies aren't working effectively, I'll reassess and advocate for changes, such as tweaking medication dosages or introducing non-pharmacological techniques like heat therapy or guided relaxation. What's most important to me throughout this process is ensuring the patient feels involved and heard. By maintaining open communication and focusing on their individual needs and preferences, I can help them feel empowered in their care.
What is your experience with wound care management?
Wound care management has been a significant part of my nursing experience, and I've developed both technical skills and a deep understanding of how to approach it holistically. In my previous role on a medical surgical unit, I regularly cared for patients with a variety of wounds, including surgical incisions, pressure injuries, diabetic ulcers, and traumatic wounds. The process always starts with a thorough assessment. I evaluate the wound size, depth, color, exudate, and signs of infection like redness, warmth, or odor. For example, when caring for a patient with a diabetic foot ulcer, I not only assessed the wound but also considered factors like blood sugar control, circulation, and their overall ability to heal. Once the assessment is complete, I implement evidence-based interventions. For surgical wounds, this often includes ensuring the dressing remains clean and dry while educating the patient on signs of infection to watch for at home. For chronic wounds, I've used advanced dressings like hydrocolloids, foam dressings, or silver-impregnated dressings, depending on the wound type and stage. I'm also experienced in wound irrigation and debridement when necessary, always focusing on patient comfort and minimizing further trauma. I also understand that wound care isn't just about the physical wound, it's about addressing the underlying causes and supporting overall healing. For instance, I collaborate with the interdisciplinary team to address nutritional needs, ensure proper offloading for pressure injuries, and coordinate physical therapy when mobility is a factor. Educating patients is another key aspect of wound care. I make sure they understand how to care for their wound at home, including how to change dressings, maintain hygiene, and recognize complications early. Seeing a wound progress toward healing, especially a complex one, is incredibly rewarding. It's one of the most tangible ways I can see the impact of my care.
How do you manage the emotional impact of caring for critically ill or terminal patients?
Caring for critically ill or terminal patients is one of the most challenging yet profoundly meaningful aspects of nursing. To manage the emotional impact, I've learned to approach it with a balance of empathy, professionalism, and self-care. First and foremost, I focus on being fully present for my patients and their families. I strive to create a space where they feel heard and supported, whether that means sitting quietly with a patient in their final moments or providing clear, compassionate communication to their loved ones. For me, building those connections is incredibly fulfilling, even in difficult circumstances. At the same time, I understand the importance of setting boundaries to protect my emotional well-being. I remind myself that while I can provide care, comfort, and advocacy, I can't always change the outcome. This mindset helps me channel my energy into what I can do, ensuring that my patients experience dignity, comfort, and as much peace as possible. I also rely on my team for support. Sharing experiences and leaning on colleagues who understand the unique challenges of critical or end-of-life care helps immensely. During particularly tough cases, debriefing sessions can be invaluable, not just to process emotions, but also to reflect and learn as a team. Outside of work, I make self-care a priority. I've found that activities like yoga, journaling, or spending time in nature help me decompress and maintain a healthy perspective. I also focus on the small joys in life, like spending time with loved ones or pursuing hobbies, which remind me why I chose this career in the first place. Ultimately, I view this aspect of nursing as a privilege. Being there for someone during such a vulnerable time is a deeply human experience. While it can be emotionally taxing, the opportunity to make a difference, even in the smallest way, keeps me grounded and motivated.
In what ways do you work to improve your patient care skills?
Improving my patient care skills is an ongoing process that I approach with intention and enthusiasm. Nursing is a field where growth never stops, and I'm committed to staying current and adaptable in my practice. One of the primary ways I enhance my skills is through continuous education. I regularly attend workshops, webinars, and conferences to stay updated on the latest evidence-based practices. For example, I recently completed a course on advanced wound care techniques, which has greatly improved my ability to manage complex wounds. I also seek feedback from colleagues, mentors, and even patients. Constructive feedback helps me identify areas where I can grow. For instance, a senior nurse once suggested ways to improve my time management during a particularly busy shift, and implementing her advice made me more efficient without compromising patient care. Hands-on experience is another key part of my development. Each patient interaction is an opportunity to learn something new. I take the time to reflect on challenging situations, what went well, what didn't, and how I can handle similar scenarios better in the future. Collaboration is also essential. I value working as part of an interdisciplinary team, where I can learn from other healthcare professionals like physical therapists, dietitians, or social workers. Their expertise often provides new perspectives that I incorporate into my own practice. Lastly, I make it a point to stay empathetic and patient-centered in my approach. Listening to patients and understanding their unique needs helps me provide care that truly makes a difference. Whether it's learning about cultural sensitivities or adopting new communication techniques, I'm always looking for ways to ensure my patients feel valued and supported.
How do you deal with the high workload and limited resources?
Dealing with a high workload and limited resources is definitely one of the more challenging aspects of nursing, but I've developed strategies to stay effective and focused in those situations. First, I prioritize. I use the triage mindset, focusing on what's most critical to patient safety and well-being. For example, if I have multiple patients needing care simultaneously, I'll address a patient with unstable vitals before attending to routine tasks like dressing changes. It's about making decisions that have the most significant immediate impact. Second, I lean on teamwork. Nursing is rarely a solo effort, and when resources are tight, collaboration becomes even more important. I make it a point to communicate clearly with colleagues, delegating tasks when appropriate and offering help in return. For instance, if a colleague is overwhelmed, I might assist with a quick task like administering medication while they handle something more complex. Time management is also crucial. I use tools like checklists and time blocking to stay organized and ensure nothing falls through the cracks. Staying flexible is key because priorities can shift quickly in a healthcare setting. Additionally, I advocate for my patients and team. If limited resources are impacting patient care, I don't hesitate to escalate concerns to leadership. Sometimes, even small adjustments, like reallocating staff or requesting additional supplies, can make a big difference. Finally, I make self-care a priority. When I'm working under pressure, taking small moments to breathe, stay hydrated, or even just pause for a few seconds helps me reset and avoid burnout. After my shifts, I decompress with activities that recharge me, like spending time with family or going for a walk. Ultimately, it's about maintaining focus on what matters most, delivering the best possible care with the resources at hand. Challenges like these are tough, but they've taught me to be resilient, resourceful, and adaptable.
Have you ever had to deal with a medical error? How was it resolved?
Yes, I've encountered a situation involving a medical error, and it was a valuable learning experience that reinforced the importance of vigilance and accountability in nursing. During one of my shifts, I was reviewing a patient's medication orders and noticed that a colleague had administered medication at the wrong dosage. The error wasn't immediately apparent but could have led to complications if not addressed promptly. As soon as I spotted it, I informed my colleague, and together we followed the proper protocol. First, we reported the incident to our charge nurse and the physician. Transparency was key. We didn't try to hide the error but instead provided all the relevant details so it could be addressed appropriately. The physician assessed the patient and adjusted the treatment plan to mitigate any potential harm. Fortunately, the patient didn't experience any adverse effects. Next, we documented the incident thoroughly and submitted an incident report. This step wasn't about assigning blame but about identifying where the system could improve to prevent similar errors in the future. For instance, during the review process, we discovered that the error stemmed from unclear handwriting on a paper chart. As a result, the unit implemented stricter guidelines for medication orders and reinforced the use of electronic prescribing whenever possible. This experience taught me the importance of double-checking everything, even if it's not directly part of my task, because patient safety is everyone's responsibility. It also highlighted the value of a supportive team environment where mistakes can be openly addressed and used as opportunities for improvement. Since then, I've been even more vigilant about checking orders, verifying dosages, and fostering open communication within the team to ensure that patient safety remains the top priority.
What is your experience with pediatric or geriatric patients, depending on the job focus?
Pediatric patients. I've had the privilege of working with pediatric patients during my clinical rotations in a pediatric ward and in a primary care setting. Caring for children requires not only clinical knowledge but also a lot of creativity and patience to engage with them effectively. For example, I once cared for a 6-year-old with asthma who was anxious about using a nebulizer. I took the time to explain the process in simple terms and even turned it into a game, letting them blow out the dragon smoke while using the mask. It made them feel more at ease and ensured they received their treatment. Communication with parents or guardians is also crucial in pediatric care. I make it a priority to keep them informed, answer their questions, and involve them in decision-making, as their insights about their child's behavior or symptoms are invaluable. Additionally, I'm mindful of developmental milestones when assessing pediatric patients, as age-specific factors often influence care plans. I've worked on creating fun, interactive ways to encourage compliance with treatments, like using stickers or small rewards, which keeps children motivated and cooperative. Geriatric patients. I've gained extensive experience working with geriatric patients, particularly during my time in a rehabilitation center and on a medical surgical ward where many of the patients were older adults. I've learned that geriatric care often involves managing multiple comorbidities, complex medication regimens, and the psychosocial challenges of aging. For example, I once cared for an 82-year-old patient recovering from hip surgery who was also managing diabetes and early-stage dementia. I tailored their care plan to address both their physical recovery and cognitive needs, ensuring they received appropriate pain management while maintaining a safe and structured environment. Communication is another key aspect of geriatric care. I make it a point to speak clearly, use non-technical language, and ensure the patient feels heard. I also involve families or caregivers when appropriate, as they play a crucial role in ongoing care. In addition, I'm vigilant about preventing complications common in older adults, such as pressure injuries, falls, or medication side effects. For example, I perform regular skin assessments and work closely with physical therapists to promote mobility, even in small increments.
How do you ensure effective communication with patients who have language barriers or disabilities?
Ensuring effective communication with patients who have language barriers or disabilities is essential for providing safe, patient-centered care. I approach these situations with patience, creativity, and a commitment to understanding the individual's unique needs. For patients with language barriers, I make use of professional interpreter services whenever possible. Whether it's an in-person interpreter, a phone-based service, or a video platform, having someone trained in medical terminology ensures accurate and culturally sensitive communication. I also use visual aids, gestures, and simple language to supplement verbal communication. For example, I once cared for a patient who spoke limited English and had concerns about post-operative wound care. Using a printed diagram and step-by-step instructions translated into their language helped bridge the gap. When working with patients with disabilities, I tailor my communication to their specific needs. For individuals with hearing impairments, I've used written communication, visual aids, and, when available, sign language interpreters. I always ensure my body language is clear and face them directly so they can lip read if that's part of their communication style. For patients with cognitive impairments or speech difficulties, I focus on creating a calm and supportive environment. I ask yes or no questions when appropriate, allow extra time for responses, and use tools like communication boards or picture cards. For example, I once cared for a patient who had suffered a stroke and had aphasia. Using a communication board with images and keywords helped us discuss their needs and preferences effectively. Above all, I treat these interactions with respect and empathy, ensuring that the patient feels heard and involved in their care. I also make a point to educate myself about cultural or accessibility considerations that might impact communication, as every patient's situation is unique.
How do you stay physically and mentally fit to perform your nursing duties?
Staying physically and mentally fit is crucial in nursing because the demands of the job can be intense, both physically and emotionally. I take a proactive approach to maintain my overall well-being so I can give my best to my patients. Physically, I focus on staying active and maintaining my energy levels. I incorporate regular exercise into my routine, like yoga and strength training, which not only keep me fit but also help with flexibility and stamina, important for long shifts. On my days off, I enjoy activities like swimming or hiking, which double as a way to recharge mentally. I'm also mindful of my diet, choosing foods that provide sustained energy, and staying hydrated throughout my shifts. Mentally, I prioritize stress management and self-care. Nursing can be emotionally demanding, so I make it a point to reflect on my day, whether through journaling or a quick debrief with a trusted colleague. These small moments of reflection help me process any challenging experiences and focus on the positives. Additionally, I set boundaries between work and personal life. When I'm off duty, I try to fully disconnect by spending time with family and friends or pursuing hobbies like painting and reading, which help me unwind and maintain balance. I also value ongoing learning and professional growth. Engaging in continued education or attending nursing workshops keeps me mentally stimulated and motivated, giving me confidence and resilience in my role. By caring for myself, I ensure that I'm in the best possible shape, physically and emotionally, to care for my patients and handle the demands of the job.
Can you discuss a particularly rewarding case you've worked on?
One of the most rewarding cases I've worked on involved caring for a young patient recovering from a severe traumatic brain injury following a car accident. When the patient was admitted to our unit, they were in a coma, and the prognosis was uncertain. Over several months, I had the privilege of being part of their recovery journey, providing both clinical care and emotional support to the patient and their family. During the initial stages, my focus was on meticulous monitoring and managing their medical needs, such as preventing complications like infections and pressure ulcers. I also collaborated with physical therapists and speech therapists to implement early interventions that would support their eventual recovery. These small steps were crucial in laying the foundation for progress. As the patient began to regain consciousness, I worked closely with the family, teaching them how to assist with rehabilitation exercises and preparing them for the challenges ahead. I also made it a point to celebrate every milestone with them, no matter how small, such as the first time the patient responded to verbal commands or moved their fingers. One of the most memorable moments came months later when the patient, who had been nonverbal since the accident, said their first word during a therapy session. Seeing the joy and relief on the faces of the family was an incredible reminder of why I chose nursing as a career. The case was a powerful example of the impact of teamwork, perseverance, and holistic care. It reinforced my belief in the importance of addressing not only the physical needs of patients but also their emotional and psychological well-being. Being part of this patient's journey, from uncertainty to recovery, was deeply rewarding and remains one of the highlights of my career.
How do you balance empathy with professional boundaries?
Balancing empathy with professional boundaries is crucial in nursing to provide compassionate care while maintaining the objectivity needed for effective decision-making. I approach this balance by fostering a genuine connection with patients while keeping the focus on their care and well-being, guided by ethical and professional standards. Empathy is at the core of my practice. I strive to understand and validate patients' feelings, listen actively to their concerns, and offer comfort and reassurance. For example, I might take a few extra minutes to sit with a patient who is feeling anxious or overwhelmed, showing them that their emotions are acknowledged and respected. This helps build trust and ensures that they feel supported throughout their healthcare journey. At the same time, I am mindful of maintaining professional boundaries. I remind myself that my role is to provide care, not to solve every personal problem or become emotionally entangled. This means being attentive and compassionate without overstepping into areas that might compromise my ability to make objective clinical decisions. For instance, while I may empathize deeply with a patient's struggles, I ensure that my actions remain focused on their medical and emotional needs rather than becoming personally involved. Clear communication also helps in maintaining boundaries. If a patient or family member seeks advice or assistance outside the scope of my role, I respond with understanding while redirecting them to appropriate resources, such as social workers or counselors, who are better equipped to address their concerns. I also prioritize self-awareness and self-care to ensure that I remain emotionally resilient. Reflecting on my interactions with patients and seeking support from colleagues or mentors when needed allows me to process emotions healthily and avoid compassion fatigue. Ultimately, balancing empathy with professional boundaries enables me to provide high-quality, compassionate care while safeguarding my emotional well-being and upholding the integrity of the nurse-patient relationship.
What strategies do you use to educate patients about preventive care?
Educating patients about preventive care is a vital part of nursing, as it empowers individuals to take control of their health and avoid potential illnesses. I use a combination of clear communication, personalized guidance, and practical tools to ensure that patients understand and are motivated to adopt preventive measures. First, I focus on building a connection with the patient. By fostering trust and showing genuine interest in their well-being, I create an environment where they feel comfortable asking questions and discussing their concerns. This rapport is essential for effective education. I tailor my approach to the patient's specific needs, health status, and lifestyle. For example, when discussing the importance of vaccinations, I explain how immunizations can protect against serious illnesses, emphasizing benefits relevant to their age, job, or community. If a patient has risk factors like a family history of heart disease, I highlight preventive strategies such as diet, exercise, and regular screenings that address their unique situation. To make information accessible, I use simple, non-technical language and incorporate visual aids, such as pamphlets, charts, or videos, when available. For instance, if I'm explaining how to conduct breast self-exams or manage blood sugar levels, I might provide step-by-step demonstrations or diagrams. I also emphasized the importance of small, achievable goals. Encouraging patients to make gradual changes, like walking 30 minutes a day or reducing salt intake, makes preventive care feel manageable and sustainable. I celebrate their progress to reinforce positive behavior. Encouraging dialogue is another key strategy. I invite patients to ask questions, share their challenges, and express their concerns, ensuring that the education feels collaborative. For example, if a patient is hesitant about adopting a healthier diet, I discuss strategies to overcome barriers, such as finding affordable, healthy options. Finally, I provide resources for ongoing support, such as contact information for community programs, follow-up appointments, or referrals to specialists like dietitians or smoking cessation counselors. By offering a comprehensive and supportive approach, I empower patients to take an active role in their preventive care and build long-term habits for a healthier life.
How do you handle situations where you disagree with a doctor's orders?
Handling situations where I disagree with a doctor's orders requires professionalism, clear communication, and a focus on patient safety. As a nurse, my primary responsibility is to advocate for the patient while maintaining a collaborative relationship with the healthcare team. When I encounter an order that I believe may not be in the patient's best interest, I first double-check the details to ensure I understand the context fully. I review the patient's medical history, current condition, and any relevant guidelines or protocols to confirm my concerns. Once I have gathered all the necessary information, I approach the physician respectfully and at an appropriate time to discuss my concerns. I use evidence-based reasoning and communicate in a clear, non-confrontational manner. For instance, I might say, I noticed that the prescribed medication is at a higher dose than usual for patients with renal impairment. Could we review this together to ensure it's safe for the patient? By framing the discussion around the shared goal of providing the best possible care, I help foster a collaborative and solutions-focused conversation. I remain open to the physician's perspective and am willing to adjust my stance if they provide additional information that addresses my concerns. If the issue remains unresolved and I still believe that the order poses a risk to the patient, I follow my institution's chain of command. This might involve consulting a charge nurse, nurse manager, or the hospital's ethics or patient safety committee. I document the incident accurately, noting the steps I took to address the concern, to ensure transparency and accountability. Throughout the process, I prioritize maintaining a professional relationship with the physician and the rest of the team. Disagreements are an opportunity to enhance patient care through open dialogue and mutual respect, and by approaching them constructively, I ensure that patient safety and well-being remain the top priority.
Can you share an experience where you had to perform under pressure?
One experience that stands out was during my time in the emergency department when a patient arrived in cardiac arrest. The situation required quick thinking, precise action, and seamless teamwork to give the patient the best chance of survival. As soon as the patient arrived, I immediately joined the resuscitation team. While one nurse prepared the defibrillator, I took charge of administering chest compressions, ensuring they were delivered at the correct depth and rhythm. The environment was intense, with everyone focused on their specific roles, and we worked in sync to perform advanced cardiac life support (ACLS) protocols. When the physician called for emergency medications, I quickly prepared and administered them, double-checking dosages to ensure accuracy despite the high-pressure environment. Simultaneously, I monitored the patient's vitals and communicated any changes to the team. At one point, the patient's condition required intubation, and I assisted by preparing the necessary equipment and ensuring the procedure was completed smoothly. Throughout the event, I remained calm and focused, relying on my training and experience to guide my actions. I also supported my colleagues by providing encouragement and helping maintain a collaborative atmosphere. Although the outcome was uncertain at the time, we successfully stabilized the patient enough for transfer to the intensive care unit. After the event, I participated in a debriefing session with the team, reflecting on what went well and identifying areas for improvement. This experience reinforced my ability to perform under pressure, stay composed in critical situations, and collaborate effectively with a multidisciplinary team to prioritize patient care.
How do you contribute to a positive workplace culture?
Contributing to a positive workplace culture is something I value deeply, as it directly impacts both patient care and team morale. I strive to foster an environment of collaboration, respect, and support by modeling professional behavior and cultivating strong relationships with my colleagues. One way I contribute is by maintaining open and effective communication. I actively listen to my teammates, respect their input, and encourage a collaborative approach to problem solving. For example, during busy shifts, I make it a point to check in with colleagues, share updates, and coordinate tasks to ensure a smooth workflow. This promotes teamwork and reduces stress, creating a more harmonious work environment. I also prioritize kindness and empathy in my interactions. Small acts, like offering to help a colleague who is overwhelmed or taking the time to acknowledge their hard work, go a long way in building mutual trust and appreciation. For instance, I once stepped in to assist a colleague who was managing a difficult patient situation, allowing them to take a short break and reset. This gesture not only helped my coworker but also reinforced a culture of support. Promoting a culture of continuous learning is another way I contribute. I willingly share my knowledge and experience with others, especially new staff members, to help them feel confident and competent in their roles. At the same time, I am open to learning from my peers and seeking feedback to improve my own practice. This creates an atmosphere where everyone feels encouraged to grow and contribute their best. Lastly, I make an effort to address challenges constructively. If conflicts or concerns arise, I handle them professionally and focus on finding solutions rather than placing blame. By fostering a respectful and proactive approach, I help create a workplace where everyone feels valued and motivated to contribute. Overall, I believe that by showing respect, fostering teamwork, and maintaining a positive attitude, I can help build a supportive and collaborative workplace culture that benefits both staff and patients.
What is your approach to dealing with unexpected situations or emergencies?
My approach to dealing with unexpected situations or emergencies is centered on staying calm, prioritizing effectively, and acting with confidence and efficiency. In nursing, unexpected events are part of the job, and my ability to adapt quickly while maintaining a patient-centered focus has been critical in ensuring positive outcomes. The first step I take in an emergency is to remain calm and composed. I've learned that staying level-headed allows me to think clearly and make sound decisions, even in high-pressure situations. This calm demeanor also helps reassure patients, families, and colleagues during stressful moments. Next, I assess the situation to determine the severity and prioritize actions. For instance, in a medical emergency like cardiac arrest, I quickly evaluate the patient's condition and initiate life-saving interventions, such as starting CPR or administering medications, while activating the emergency response team. I rely on my training, such as basic life support, BLS, and advanced cardiac life support, ACLS, to guide my actions. Collaboration is also a key component of my approach. I communicate clearly and efficiently with my team, assigning roles and sharing vital information to ensure that everyone is aligned and working toward the same goal. In one case, when a patient experienced an unexpected respiratory collapse, I coordinated with colleagues to stabilize the patient, while ensuring that other patients on the unit were still attended to. Flexibility and adaptability are also essential. Emergencies often require me to shift focus or adjust plans on the spot, and I embrace this challenge by remaining prepared and confident in my abilities. I regularly update my skills through training and simulation exercises, so I'm equipped to respond effectively to a wide range of scenarios. After the situation is resolved, I take the time to reflect and debrief, both individually and as a team. This helps identify what went well and areas for improvement, ensuring that I'm better prepared for future unexpected events. By combining preparation, teamwork, and a calm, decisive approach, I am able to handle emergencies effectively while maintaining high standards of care.
How do you ensure that you are respecting the rights and dignity of your patients?
Respecting the rights and dignity of my patients is fundamental to my practice as a nurse, and I approach it with empathy, professionalism, and adherence to ethical and legal standards. I recognize that each patient is a unique individual with their own values, preferences, and rights, and I strive to ensure they feel respected and empowered throughout their care. To uphold their rights, I begin by ensuring that patients are fully informed about their condition, treatment options, and care plans. I use clear, simple language to explain medical information and encourage them to ask questions. By involving them in the decision-making process and obtaining informed consent, I respect their autonomy and ability to make choices about their own health. I also make a conscious effort to maintain privacy and confidentiality. Whether I'm closing curtains during a procedure, speaking discreetly about sensitive matters, or safeguarding their medical records, I prioritize their right to privacy at all times. For example, if discussing a diagnosis, I ensure that conversations happen in private settings where the patient feels secure. Treating every patient with dignity means recognizing and accommodating their individual needs, preferences, and cultural beliefs. I approach each interaction with empathy and an open mind, asking questions to understand what matters most to them. For instance, I respect religious practices or dietary restrictions and adapt their care plan accordingly, ensuring they feel valued and understood. Additionally, I advocate for my patients, particularly those who may feel vulnerable or unable to speak up for themselves. If I notice that a patient's rights are not being fully respected, I take appropriate steps to address the situation, whether by speaking with a colleague or escalating concerns to a supervisor. Lastly, I regularly reflect on my practice and seek feedback to ensure that I am continually improving in respecting patients' rights and dignity. By combining compassion, communication, and adherence to professional standards, I create an environment where patients feel safe, respected, and valued as individuals.
What do you think sets you apart from other nursing candidates?
What sets me apart from other nursing candidates is my combination of diverse clinical experience, strong interpersonal skills, and unwavering commitment to providing patient-centered care. I bring a holistic approach to nursing, blending technical expertise with empathy and adaptability to meet the unique needs of every patient. One quality that distinguishes me is my ability to thrive in fast-paced and high-pressure environments. My experience in critical care and emergency settings has equipped me with the skills to make quick, informed decisions while maintaining composure and focus. For example, I've managed complex cases involving critically ill patients, coordinating seamlessly with interdisciplinary teams to deliver timely and effective interventions. This adaptability ensures that I can excel in challenging situations and provide the best care possible. Another strength is my dedication to fostering positive relationships with patients and their families. I understand that nursing is as much about emotional support as it is about clinical care, and I prioritize active listening and open communication. Patients often express their gratitude for my ability to make them feel heard, valued, and reassured, even during difficult times. This skill not only enhances the patient experience but also builds trust and facilitates better health outcomes. I also stand out for my commitment to lifelong learning and professional development. I have pursued certifications in areas such as advanced cardiac life support, ACLS, and infection prevention, staying up to date with the latest advancements in nursing practices. Beyond technical skills, I actively seek opportunities to develop leadership abilities, such as mentoring new nurses or participating in quality improvement initiatives, which allows me to contribute to the growth of my team and the broader healthcare environment. Finally, my approach to teamwork sets me apart. I view collaboration as the cornerstone of effective patient care and strive to create a supportive and cohesive working atmosphere. Whether it's stepping in to assist a colleague during a busy shift or sharing insights during a team meeting, I am dedicated to fostering a positive and productive environment. Together, these qualities make me a well-rounded nurse who can deliver exceptional care, support colleagues, and adapt to the dynamic needs of any healthcare setting.
Where do you see your nursing career in the next 5 years?
In the next 5 years, I see myself continuing to grow as a nurse, both clinically and professionally, while making a meaningful impact on patient care and the healthcare system. My vision includes expanding my skills, taking on leadership roles, and contributing to the advancement of nursing practice. Clinically, I aim to specialize further in insert area of interest, e.g., critical care, pediatrics, or oncology, deepening my expertise to provide highly specialized care. I plan to pursue advanced certifications relevant to my chosen specialty, such as Certified Critical Care Nurse, CCRN, or Certified Pediatric Nurse, CPN, to ensure I stay at the forefront of best practices and new developments in the field. In addition to enhancing my clinical skills, I aspire to take on a leadership role, such as charge nurse or clinical educator. I believe that mentoring new nurses and helping them develop their confidence and skills is an essential way to give back to the profession. I also want to play a role in fostering a positive workplace culture, contributing to team cohesion and quality improvement initiatives that enhance both patient outcomes and staff well-being. Another important goal is to further my education. I am considering pursuing an advanced degree, such as a Master of Science in Nursing, MSN, or becoming a nurse practitioner, NP. This would allow me to take on more responsibility, provide a higher level of care, and make a broader impact on the healthcare system. Lastly, I want to continue advocating for patient-centered care and contributing to initiatives that address healthcare disparities. Whether through volunteering, community outreach, or policy advocacy, I see myself working to improve access to care and health education for underserved populations. By pursuing these goals, I aim to grow both personally and professionally, ensuring that I make a lasting contribution to my patients, my team, and the nursing profession as a whole.